Good evening, guys. Discussion C tonight is about young onset dementia. Okay, so we're going to dig into that for C tonight. Here we go. Young onset dementia is not simply an early version of an old disease. It is a life-altering rupture that arrives in the life or the middle of a person's becoming. Below is a full narrative driven essay shaped for your voice as a palliative care physician and a healthcare system leader with emotional depth, lived experience, and textured and policy aware framing. Okay, guys, here's the title. When the Future Comes Early, a narrative essay on young onset dementia. Young onset dementia does not wait for retirement, for the slowing down of life, for the gentle drift into older age. It arrives in the middle of carpools and careers, in the thick of mortgages and marriages, in the years when a person is supposed to be building, expanding, becoming. It is a thief that chooses the brightest hours of the day for the families I've walked alongside. The first signs are rarely dramatic. A missed meeting, a forgotten password, a sudden difficulty following the pilot of a familiar TV show. Partners often describe a subtle shift, something in the way he looked at me, like he was searching for the right version of me in his mind. These early moments are easy to dismiss. Stress, burnout, too much on the plate. But young onset dementia is persistent. It keeps knocking. The slow unraveling. In their 30s, 40s, and 50s, people are expected to be competent, productive, reliable. So when cognition begins to fray, shame often arrives before diagnosis. I remember one woman telling me she felt like she was failing at adulthood. She had been a project manager, the kind of person who color-coded her life. Suddenly she couldn't remember the steps in her own workflow. She cried in the parking lot after work, terrified someone would notice. Her husband described the moment he realized this wasn't stress. She looked at the microwave like it was a puzzle. She asked me how to make it start, and I knew this wasn't my wife having a bad day or bad week. Young onset dementia is not only a neurological condition, it is a social earthquake, careers collapse, income disappears, identity fractures, friends pull away, unsure how to navigate a disease they associate with grandparents. Children become witnesses to a parent's cognitive erosion long before they have the emotional tools to understand it. The caregiver's world. Caregivers of young adults with dementia often live in a dual reality. They are still raising children, still working, still managing the logistics of daily life, while also becoming the memory, executive function, and the emotional anchor for their partner. They describe exhaustion that is not simply physical but existential. One caregiver told me, I lost my husband twice. Once to the disease and once to the life we were supposed to have. Another said, people keep telling me to take time for myself. I wanted to scream. Time was the one thing I didn't have. Young onset dementia compresses decades of caregiving into the years when a person is least able to step away from responsibilities. It is caregiving in the middle of life's busiest intersection. The body remembers what the mind forgets. As the disease progresses, the person's linear world becomes both smaller and more mysterious. A man who once ran marathons may begin pacing the house for hours. A woman who once led board meetings may sit silently folding and refolding a dish towel. The brain loses its ability to organize reality, but the body continues its rituals, a haunting echo of who they once were. And yet, moments of connection still break through. A familiar song, a smell of favorite meal, the touch of a spouse's hand. These moments remind caregivers that love is not stored only in memory, it is stored in muscle, in breath, in the quiet recognition of presence. The system's blind spot. Young onset dementia exposes the gaps. Our health system, our healthcare system, most dementia services are designed for older adults. Young patients fall into administrative cracks. Too young for senior programs, too impaired for workplace protections, too complex for standard disability pathways. Families often spend months, sometimes years, fighting for recognition, resources, and supports. The diagnosis itself can take far too long. Clinicians may dismiss symptoms because the patient is too young. Insurance may deny neuropsychological testing. Employers may interpret cognitive changes as performance issues rather than medical ones. The result is a prolonged period of suffering before help arrives. What remains? Despite the devastation, young onset dementia reveals something profound about human relationships. Caregivers often describe a fierce, unexpected tenderness, a recalibration of love that is quieter, slower, more deliberate. They learn to communicate without relying on memory or language. They learn to celebrate small victories, a smile, a shared laugh, a moment of calm. One spouse told me, I stopped trying to bring him back to who he was. I started meeting him where he is. And in that place, we still find each other. The truth at the center. Young onset dementia is not simply a disease of forgetting. It's a disease of interruption, of futures cut short, of identities rewritten, of families forced into roles they never imagined. But it is also a story of resilience, of caregiving as an act of devotion, of communities learning to hold one another through the hardest seasons of life. It asks us to rethink what it means to accompany someone through cognitive decline. It asks us to build systems that recognize the unique burdens of early life dementia. It asks us, above all, to remember that even when memory fades, dignity must go on. Okay. Here, guys, here's the second part of C. Give me a couple seconds to set that up for you. The age of unfinished stories, the rising global burden of young onset dementia. Young onset dementia does not wait for old age. It arrives early, in the middle of careers, marriages, and child rearing, interrupting lives at the very moment they are most densely lived around the world. Its burden is rising sharply, yet it remains largely invisible in public discourse and policy. We talk about dementia as a disease of the old. Increasingly, it is not. The numbers telling the story of acceleration over the past 3 decades, dementia in young people younger than 70, including all young onset cases, has surged. Prevalence up 122%. New cases up 128%. Deaths up 119%. Disability up. Places global prevalence at 119 per 100,000 people age 30 to 64. A figure that climbs steeply with age. These are not small shifts. They represent a global epidemic. Pivot, one that demands attention from health systems, employers, and policymakers. But the statistics alone cannot capture the rupture young onset dementia creates. This is a disease that steals language from teachers, judgment from engineers, empathy from caregivers, and memory from parents who still have children at home. It's a disease that forces teenagers into caregiving roles and partners into sudden single income households. It's a disease that rearranges family roles with brutal efficiency. Young onset dementia rarely begins with the memory loss we associate with Alzheimer's. Instead, it starts with subtle cracks in executive function, personality, or language. A father in Nairobi begins missing deadlines at work, colleagues whispering about burnout. A teacher in Pablo loses words mid sentence. Chalk pauses in her hand. A woman in Mumbai becomes uncharacteristically irritable, her family chalking it up to stress. These symptoms mimic depression, anxiety, or exhaustion, and clinicians often misdiagnose them as such. The average diagnostic delay can stretch for years, years in which families struggle to understand what is happening, and patients lose precious time for planning. The biology of onset dementia is the biology of young onset dementia is more heterogeneous than late life disease. Frontal temporal lobe dementia, with its systemic personality shifts, is disproportionately common. Genetic Alzheimer's disease, often aggressive and devastating, strikes families with cruel precision. Atypical Alzheimer's variants erode versions of language first, confusing both parents and clinicians, or patients and clinicians. Secondary dementias, autoimmune, metabolic, infectious, and add further add, add further complexity in many countries. Advanced diagnostic tools such as PET imaging, CSF biomarkers, and genetic testing are inaccessible or unaffordable, leaving families without answers. The economic consequences are profound. Young onset dementia is not only a medical condition, it's an economic event. People lose jobs at the height of their earning potential. Families lose stability. Health systems lose workers. In middle income countries where social safety nets are thin, the burden is especially heavy on women who bear a disproportionate share of both dementia risk and caregiving. Responsibility are affected, doubly affected. The global burden follows the, the fault lines of inequity. Yet, despite its rising prevalence, young onset dementia remains largely absent from global health policy. It does not fit neatly into aging agendas, nor does it align with pediatric or adult chronic disease frameworks. It lives in policy no man's land. Families often describe feeling abandoned, too young for senior services, too complex for mental health systems, too medically intricate for primary care alone. Just a second, folks. The silence around young onset dementia is not beginning. It's a form of structural neglect. When the disease strikes people in their 40s and 50s, the consequences ripple outward. Children's futures, household finances, community leadership, workforce participation, and long-term care systems all feel the shock. The global burden of onset dementia is not only measured in dailies of incidence curves, it's measured in unfinished stories. The mother who can no longer remember the way her child's voice sounded at the age of 5. The husband who the husband who forgets the home he built. The colleague whose brilliance fades into confusion. We need a new global response, one that recognizes the unique social, economic, and emotional terrain of young onset dementia, one that invests in early diagnostic pathways, age appropriate long term services, workplace protections, and caregiver support tailored to midlife families, one that expands research beyond late life Alzheimer's, and includes diverse populations, one that acknowledges the disease's complexity, and refuses to let it remain visible. Young onset dementia is rising. The silence is still too deep. But the stories, the unfinished ones, are beginning to be told, and if we listen closely, they will tell us what we must build next. Okay, guys, that is your seed for tonight. I will be on tomorrow for shows. Until then, Gator Wellness. Take care, folks. Have a good evening.